Specialists, and urinary and bowel incontinence are two of my areas of specialty. And so this is one of my passions to treat because these are very detrimental to patients' quality of life and really bothersome. And people tend to be really happy when we can help them with these problems. So you'll hear a little bit more about some of the risk factors, some of the treatment options, how we can help. And then, like I said, we'll have a chance to answer questions at the end. So with that, I think we'll go ahead and get started here. I'm just gonna minimize this. And then we'll go ahead and start the presentation if you don't mind, Teresa. Okay. I already introduced myself. Perfect. Okay. So the good news is that bladder and bowel issues aren't inevitable, meaning you do not have to live with them. They're not a normal part of aging or something that you just have to deal with. So if any of the following sound familiar, if you're urinating more than 8 times a day, or if that's hard to conceptualize, about every 2 hours or more during the daytime or more than once at night, have this strong have to go now feeling like you've got to find a bathroom right away, it's an emergency. If you're constantly planning your activities around a bathroom break, if you're waking up multiple times, worried about how much you eat or drink, or using pads to control your leaks, your body is probably trying to tell you something, and then that's not normal. We can go on to the next slide. Okay. So if you're asking yourself these questions, will I ever regain control? Will I be able to go to an outdoor celebration? I'm scared to leave my house. Can I wear white again? How can I possibly get a date or go get a job? Then it's time for a change. And so you may not know that 48% of people with overactive bladder reported a loss of confidence. I'm surprised it's not more. And 64% of people that experience bladder symptoms are not currently using any treatment to manage their incontinence, which is so devastating for those of us like myself who treat this for a living and are here to help. Next slide, please. Okay, so incontinence affects people of all ages. Okay, so it can affect social function, mental health, sleep. We already mentioned that half of people living with overactive bladder have a loss of confidence. Bowel issues, I think, are even more taboo. People feel less comfortable discussing those than even urinary issues. And 70% of women and nearly the same amount of men are embarrassed to seek care. 88% of patients reporting that their fecal incontinence symptoms had an impact on their quality of life. And so if you put it in perspective, bladder control problems affect 1 in 6 adults. So that's 43 million individuals in the United States alone. And bowel control problems affect about half as many, but still 1 in 12. So that's 64 plus million people that are struggling with these conditions. Next slide, please. So, what causes bladder and bowel control problems? Well, some things like what you eat or drink can contribute. Sometimes medications, a history of pregnancy, childbirth, or pelvic floor injury. And basically, when your body is functioning properly, nerves signal your brain when your bladder or rectum are full and need to empty. When you experience troublesome symptoms, there could be a miscommunication between your brain and bladder that can lead to urinary or fecal incontinence. Next slide. Okay, so the good news though is if you're experiencing these problems, there is treatment options available. So how does bladder and bowel control work? Well, the brain-bladder communication is essential to maintain the control. Okay, and communication breakdowns can cause bladder and bowel control problems. Now, that's not saying that you have to have a history of back surgery or something like that where you know there's a known injury, but sometimes it just happens for whatever reason. Unlike conventional treatments, Medtronic sacral neuromodulation, which is what I use here in our office, stimulates the sacral nerves in your pelvic area that control your bladder and bowel to try to target the root cause of the problem. Next slide, please. Okay, so what is stress incontinence? So stress incontinence is leaking with activity such as coughing, laughing, sneezing, exercising, bending, lifting, or if you have leakage with an activity and you're frequently urinating in order to prevent that leakage, these can all be symptoms of stress incontinence. Now, Medtronic bladder control therapies do not treat stress incontinence or obstructive urinary retention or mixed incontinence, which we'll talk about later, but great treatment options do exist, and we can certainly talk about that on another day. Next slide, please. So what's urinary retention? In a nutshell, urinary retention is not being able to urinate. So if your bladder is full and you either need a catheter to empty your bladder or your stream is weak and you can't seem to get all the urine out, then you may benefit from treatment of your urinary retention. Next slide, please. What's overactive bladder? Well, overactive bladder is the gotta go, gotta go. So leakage before you get to the bathroom, leaking after a small amount of liquid. If you turn on the running water and it causes you to leak, you need pads or protective garments because you're not sure when it's going to happen. Like I said, if you're going more than 8 times a day or have the frequent uncontrollable urgency to go, regardless of how frequently you went to the bathroom, these can all be symptoms of overactive bladder. Okay, so what is fecal incontinence? Well, fecal incontinence is leakage of stool, and there's several types, but urge incontinence would be you have a strong urge and then you experience leakage. Passive incontinence might be you don't even realize it's happening. You don't feel when you have to go, and maybe you go to the bathroom and realize that you've had an accident. And so if you're having accidental loss of stool or stool when you every time you go to urinate, if you're finding the undergarments that are stained, these are all symptoms of fecal incontinence. Next. Okay, so there are many ways to treat incontinence, and let's dive into how we can help. So there are a few steps you want to take on your own, or that you can take on your own to get started before you speak with a specialist. But basically, we can start with lifestyle changes, medications, which have to be prescribed, and then there are other more involved treatments that we can help you with. And so let's talk some more about those. Okay, so lifestyle changes. I know this will come as a shock to many of you, but you do not have to drink 8 glasses of water every day. In fact, that number is not based on any science or any rigorous study. It was kind of a made up number that, shocker, came out about the same time as bottled water. So I think of it as kind of a media ploy to sell bottled water. If you have a normal thirst mechanism and you just drink when you're thirsty, you're going to get more than enough water. Caffeine, we all love it. I love my coffee. I drink it every day, but you really should try to minimize the amount of caffeine and keep it to about 1 cup a day. Certain dietary triggers can offend the bladder or cause leakage of stool, and those are very individual. Certain exercise. So um, if you can't go to the gym or do jumping jacks because you leak, that's another, option. We could kind of modify our activity or treat it. Physical therapy can help some people. Kegel exercises can help some people, but a lot of individuals have tried and failed all of these things and still require more treatment. So there are oral bladder medications, and there's a number of these that are on the market and very few that I actually use, mainly due to side effects. And so the biggest side effects that cause patients to stop their medications are dry mouth, blurry vision, constipation. But the real kicker is a lot of these drugs can cause dementia. And I think a lot of prescribers are not as familiar with that side effect, nor are patients. And when patients find this out, they're shocked to hear that they've been on such a dangerous drug and are eager to stop it. So there's 2 medications that I like to use that are not affiliated with these side effects. One can cause high blood pressure. The other can be a little cost prohibitive, but in certain scenarios, they're very helpful. If medication is not an option, or if you failed medication, then there are more involved therapies, and we call those third-line therapies. We'll talk about those next. So with advanced therapies, for bowel control, there's really only one good option, and that's the Medtronic InterStim system. For bladder control, we have a couple of different options, which is kind of nice to have a broader menu. So you have the same Medtronic InterStim system that we use for bowel control, AltaViva, which was just rolled out by Medtronic, which is an implantable tibial device, tibial nerve stimulation in the office, which is Medtronic Neuro, and then injected medications like botulinum toxin. Okay, so Botox, or onabotulinum toxin A, temporarily treats leakage associated with urgency and frequency. It's injected typically in the office right into the bladder muscle with a small needle in a camera through the urethra. The biggest downsides to Botox are that it can cause difficulty emptying, and rarely patients would need to catheterize themselves, although this does always wear off. And it's a repeated option. So it's not a one and done. We have to do this about every 6 months, sometimes more frequently. And it is not indicated for bowel control issues. Slide. Tibial nerve system. So posterior or percutaneous tibial neuromodulation, PTNM, is the Medtronic Neuro system. This is great if you have downtime and you're flexible and you're willing to come to the office for a 30-minute session with a good book. We usually do that once a week for 12 weeks, followed by maintenance sessions once a month. And this can be really helpful for people who are not interested in a surgical approach or Botox and have the time required for the treatment. And then we have sacral neuromodulation. So this is where the Medtronic InterStim system comes in. The great part about this treatment is that it actually targets the root cause of the problem, which is that brain bladder miscommunication, unlike the other therapies. The other nice thing about this is we get to try it before we proceed. And so we have a test phase in the office that is, it's testable, reversible. There's no general anesthesia, anything like that. You try it out for a week, see what life would be like with the implantable device. And if you're happy and you meet a certain threshold of improvement, that device can be implanted under the skin under a sedation anesthetic like a colonoscopy. No need to recharge, and that battery lasts for 10 to 15 years. So it really is quite a nice durable option compared to some of the other treatments. So for most patients who do the tibial nerve, who do the sacral neuromodulation test, we do it for 1 week. We insert a very thin wire into the upper part of the buttock and then attach that to an external battery, which powers those temporary leads for the first day. We put one on the right side, one on the left. You kind of try them both out. You can turn it up or down, see what it feels like, and fill out some symptom diaries to have objective data about whether or not it was helpful for you. And then after a week, we review together whether it was a good option for you, remove those leads, and determine next steps, which could include that surgical implant. So 84% of patients were satisfied who used InterStim for bladder control. Compared to medication, patients experienced 3 times greater improvement in quality of life. 89% of patients using Medtronic bowel control experienced long-term success. And thus far, over 450,000 patients have been implanted over the last 25 years. So this is a very long, well-studied, proven therapy that has been a part of my practice for the last 15 years. The great news is before we used to think, oh, shoot, maybe we can't have an MRI. Now we know with rigorous studies and new technology, it's very safe to have an MRI. You just have to put it in a specific mode, and then you can very safely have your MRI without concern of damage to the device or any interference with your test. So the other thing that's kind of nice is we have this My Journey app. And so if you're someone who prefers pencil and paper, I understand I can sometimes get the same way, but we have an app. You can download the QR code, easy instructions showing you how to mark when you leak, how often you're peeing. And so that data is captured in real time so we can easily analyze that and determine, hey, how much improvement did you get? Well, did we hit that 50%? How are you feeling? Oh, look, you only woke up once last night. You must have slept better. It's just kind of a nice way to have really good objective data to help you make the right decision for you as to whether or not this therapy is right for you. And so, you may be a good candidate for Medtronic therapies if your symptoms are bothersome and you've already tried and failed lifestyle and oral medications and you haven't had the relief you want. And so if you're on this webinar, it's possible that you've tried medications, it's possible that you've tried some of the third line therapies, or maybe you're just now kind of learning that there are treatment options. And so the first steps would be drink less fluid, minimize caffeine, kind of pee every 2 hours on a schedule. And if that doesn't do it, then we have a lot of options to help. Okay, so this patient says, InterStim therapy has given me freedom from searching for restrooms or worrying about embarrassing moments. And I can attest that we have lots of patients who say the same thing and are very satisfied with their therapy. Okay, so with that, I'm happy to take any questions. Like I said, my name is Dr. Lauren Wood. I work here in Sioux Falls at Urology Specialists. We'd be more than happy to speak with you or a family member if this is something that you struggle with. And we have a follow-up poll if you have a second to fill that out. Question 1, have you ever heard of Medtronic InterStim prior to tonight? Yes or no? Question 2, would you like to schedule an appointment to discuss next steps? And then was this presentation helpful? And if you have any additional feedback, please feel free to type that in. We also have the option to free text questions in the chat box. And so we will happily take any questions. I'll be around for a few minutes. And if there's anything we didn't cover and you wanted to discuss further, please don't hesitate to reach out and I'll be available to answer questions. Thank you all so much for coming.